on the inferior third of the fibula and the fibular head, and just feel how much mobility I have in the anterior posterior direction. That's the main thing we can feel. So I'm just going to see how well this is moving posteriorly and anteriorly, which is big if they've had a lot of ankle injuries or an ankle sprain, because that could definitely affect the position of this fibula. The ligaments can kind of crate this puppy in different directions. So I'm going to go back and forth here and compare both sides with that on the inferior tib fib joint. And then with the superior tib fib joint, I can do this sitting, I can do this side lying in this position. Any of these work fine. So what can you tell me about the superior tib fib joint? What's the joint angle? It's like that.
Yeah.
Something there.
It's oblique.
Yeah, so it's oblique. It's sitting on the posterior lateral part of the tibia. The joint angle itself is going to be anterior lateral, posterior medial. And so if you want to do a distraction of this, which is difficult, you'd have to go back and down this way. But it's really hard to distract this bone because you've got the fibular nerve going around there also. So you got to be careful around the neck of the fibular head. And mostly with this also, we can do, mostly with this also, great English, we can do anterior and posterior. So I'm going to get around here, I'm going to stabilize the tibia, I'm going to wrap around the fibular head, being careful around the neck, and I'm going to see how well it moves in an anterior, lateral, posterior, medial direction. So we'll assess that, we'll compare that to both sides. I might do this in different positions of knee flexion and extension. There's going to be different amount of muscle and fascial tension through there. And then also I'd like to get in here and assess how well it's moving in a distal and superior glide. We don't have a technique for this specifically, but if you've had hamstring guarding or you feel like it's been kind of pushed down and stuck in that position, I like to grab around the fibular head and around the inferior part of the fibula and just give it a little bit of pull and the inferior and then a proximal glide and just compare. If it reproduced symptoms, is this reproduced back pain, sciatic pain, and compare side to side on mobility with that, just to get a general idea how it's moving this way.